Well, hello everyone. It's a concerned Dr. Miskoff, and I am vlogging here from my backyard in Toms River, New Jersey. You can see it's just a beautiful, beautiful, beautiful night. Just not a cloud in the sky, just a little breeze, perfect weather, and another day fighting COVID-19. Happy to report I am off tomorrow, and we'll just take it easy again. Today, when I got home, just took a nice walk with the family, and then a little basketball with my son. Um, Amazing how we take some things for granted. Just being able to do those little things now just goes such a long way and feels so great. Hopefully, we're moving faster, understanding the virus, and in the near future we can see these numbers seriously plummet. We're already seeing a significant reduction of hospitalizations, which is good, at least at our facility. I can't speak for the rest of the country this moment. We know that the numbers are still up there, though, and that we're still losing some lives on a daily basis. Good news again with Remdesivir getting emergency authorization to be used. 1 million doses, hopefully to start shipping as soon as next week. It's a really great thing, as I vlogged about last night. I think being able to give the clinician the opportunity to use the product and a true antiviral early. What I'm hoping for is that we'll get another surprise for an anti-IL-6, a Sarilumab or Tocilizumab. To get a surprise approval from the FDA on one of those, and to have both Remdesivir and an anti-IL-6 available, not just inside of research, but to use, sooner to the admission, I think would really help us, moving forward. And of course, the clinical trials are being done. We'll know the data soon enough, but in the interim, we have experience with it. I'm not going to say they're perfectly safe, these agents, but at least we have some experience and at least seem to be any side effects manageable. Time will tell for sure the true safety and efficacy for COVID-19 with Remdesivir and with the anti-IL-6s, and which anti-IL-6, Sarilumab or Tocilizumab, will get that first approval. If it'll happen at the same time, I think will depend on data release like Gilead did, and if we get more, it may be helpful. Of course, Sarilomab getting a press release recently, seeing that it wasn't really helping that really milder early on case, supposedly, but the more severe case, they did see some benefit and reductions in CRP, some kidney function improvement, etc. We talked about that on a previous vlog. But again, giving the clinician the option of getting that Remdesivir started with a pulse oximetry, where we would consider it severe. Some would say 92. Gilead used 94 as a cutoff, or needing supplemental oxygen. Of course, patients that were being admitted that even had reported pulse oximetries that were less than 92, as of a week ago, or even sooner, patients who were at nursing homes and we had a pulse ox of 84% one time, and they came in, they got supplemental oxygen. Those patients were given Plaquenil, many of them, and hydroxychloroquine, and overnight, really with the warnings from the FDA and the VA study, etc. Pretty much, at least, my colleagues not using Plaquenil pretty much anymore overnight in the last few days, really. Not having to worry about the QTC prolongation on EKG with Remdesivir, at least as far as we know at this point. That was an issue, obviously, with Plaquenil, and especially when combined with an antibiotic like azithromycin. So I encourage the FDA, our president, to get together and do what they just did with Remdesivir and get an anti-IL-6 in our hands for earlier use. It would be great to be able to have that. For now, everybody have a great night. Please stay safe and enjoy tonight, and the beautiful weather and simple walks just around the block.